Dr. King said that of all the injustices, inequality in healthcare is the most shocking and the most inhumane. And so when we passed the Affordable Care Act in this country and Georgia refused to expand Medicaid, I thought it was important to stand up. And so in this case, we stood up by sitting down. I staged a sit-in in Governor Nathan Deal's office. And during the sit-in, I was literally holding that sign with Dr. King's quote about inequality in healthcare. I was arrested along with a number of other folks who were engaged in that protest. And I just thought it was critically important to dramatize what we were doing or what we were failing to do here in Georgia. We literally are seeing people in this state uninsured and unnecessarily unemployed because politicians, Georgia politicians, were standing between the people and the care that they needed, financed by the money that they've already paid in their taxes. It's unjustifiable, it's impractical, it's immoral. Our current United States senators, Kelly Loeffler and David Perdue and Doug Collins on the House side, they're playing politics. And I guess they have the privilege of playing politics. After all, they have health care. Recently, we heard that the Southwest Georgia Regional Medical Center closed. That means that the citizens of Randolph County, and this is just one example, will have to drive as much as 45 minutes to get medical care. Well, if you're having a heart attack, or if you're in the middle of some other kind of medical emergency, 45 minutes to get to the hospital feels like an eternity. And it literally could be the difference between people living and dying. I stand at bedsides with people who are sick and trying to get well. I've been in the waiting rooms of intensive care units with countless families as they have had to make tough decisions about their loved ones. I don't know that people think about it in those terms when they go to the ballot box, but that's really what's at stake. Elections are hugely consequential. And when you're talking about healthcare, particularly in the middle of a global pandemic, elections can literally be a matter of life and death. I think people are wondering why nobody's looking out for them. They're looking out for special interests. They're looking out for insurance companies. I think ordinary people are asking, well, who's looking out for us? And because I've been one of us for so long, I've spent my career and time in service and not in politics. I think I bring that perspective to Washington, which is clearly broken and has lost its way.